I'd now like to welcome Dr. Tara Houlihan, who's the Senior Clinical Psychologist at the University Hospital in Cork. Tara's going to talk to us about emotional and well-being, managing anxiety, of which a lot of patients are struggling with at the moment. Welcome, Tara.
My name is Dr. Tara Houlihan, and I'm a Senior Clinical Psychologist at the University Hospital. I work within haematology and oncology departments. In this presentation, I'm going to talk to you about the psychological impact of COVID-19, look at strategies for managing emotional distress you might be experiencing now or in the future, and talk about ways to boost your well-being and live well in the uncertain world we find ourselves in at the moment. There is a lot of challenges we have faced so far and continue to face with an evolving COVID-19 situation. For example, we cannot have the same contact with loved ones or our trusted supports in the same way as before. There might have been changes to our jobs. For example, we may be working from home. We might do a lot of our work virtually using online video forums instead of face-to-face meetings. We might have been furloughed, or for some of us, our jobs may not have survived the lockdown measures put in place. There have also been changes to healthcare. For example, we might meet our healthcare team virtually now instead of face-to-face. Appointments may have been cancelled or postponed, and we might be reluctant to attend appointments due to fears of contracting COVID-19. We need to be more vigilant on a daily basis. So just like a meerkat looking out for threat, we can find ourselves thinking of actions now that we wouldn't have before. So for example, maybe thinking of what our hands might have touched and whether we washed them. Thinking how close we are physically to people. Thinking about where we go. We may also experience challenges in getting our basic needs met. For example, needing to ensure we have enough supplies of food and essential goods. For people who are cocooning, maybe having difficulties getting food delivered, having to make arrangements with banks to manage mortgage repayments, and so on. And with all of these changes to our lives, we are also having to deal with not knowing when this will end and what the future might look like. What we know from outbreaks of infectious diseases in the past, and also from what patients tell us now, is that it can bring up a whole host of emotions, and it is very rarely that just one we experience. Actually, it's very common for several or all emotions to be part of the picture at any one time. So the types of feelings we may be experiencing include fear and worry, both for our personal safety and that of our loved ones. We may be worried whether we or our family members or friends might get sick. And this can be particularly distressing in the context of also having an MPN. Some people might be feeling lonely and isolated due to cocooning, social distancing and limited social contact, or maybe not being able to have visitors if you're in hospital. You might have felt annoyed about having to remain at home as much as possible, not being able to do the same things, having had to cancel plans, holidays, and so on. You might feel sad about things you've missed out on, the changes to our lives, and some people may be feeling sadness and grief about loved ones they might have lost during this time. A build-up of all of these emotions can be overwhelming, and we may find it difficult to cope. We might also feel like we've lost control of our lives and feel hopeless about things changing in the future. One of the first experiences some of my colleagues shared with me was that they noticed that their sleep suffered when they became aware of COVID-19. For example, they were finding that they were waking up more frequently during the night. They were having difficulty falling off to sleep, and for some, they were waking up very early in the morning time. You may also notice that you eat more or less now than before, and there may be a change in your weight. So there are changes in our eating patterns. I found that my concentration was all over the place when I first learned about COVID-19, and particularly when the country was about to go into lockdown earlier this year. So much so that on my way home from work that day, I filled my car with diesel instead of unleaded petrol. So our minds can be very easily distracted when something as big as this happens. We may also have noticed sensations of anxiety in our bodies. For example, our muscles might feel tense, we might have aches and pains, we might find it difficult to relax, feel tired, or our heart might be beating faster. And what you also may have noticed is a change in your behaviour. Maybe you are avoiding people, places, or situations now that you wouldn't have before, because maybe you feel more anxious in these situations now. The first thing to note is however you are feeling is normal. This is a time that looking after yourself is so important, not only for your health, your overall health, but particularly for your mental health. I'm going to talk to you now about some self-care habits that will put you in a stronger position to manage the stress and to tolerate uncertainty. The first is to create a new routine. A routine provides structure to your day and also increases your sense of control. So, for example, aim to get out of bed at the same time each day. Plan your day in chunks of time. So, for example, allocate time for meals, work, study, exercise, and so on. Write a realistic to-do list and check off items as you complete them. Take care of your basic needs. So that will be looking at your diet, maybe the amount of fruit and vegetables you consume on a daily basis, the amount of processed food we eat, and aiming for a healthy balance in our diet every day. Getting good sleep is also very important for your self-care. Trying to have a regular routine, so maybe getting up at the same time and going to bed at the same time every day. And knowing how to relax. So, knowing how to wind down so that you're better able to get yourself ready to go to sleep. Try to limit your intake of caffeine, tobacco, and alcohol, because they are what we call short-term coping mechanisms, and in the long run, they don't benefit our health. Also, it is easy to mistake signs of anxiety for too much caffeine. So it would be about slowly switching to decaffeinated coffee, for example, and you should notice the difference within weeks. Getting out and getting active can be a real boost to your self-care. So that could be walking outside, it could be gardening, it could be running a marathon if that's what you want to do. It could be yoga, doing daily stretches, whatever will interest you and get you moving. Make sure to include time for hobbies and interests every day, as it gives us a break from the routine of day-to-day life. So it might involve rediscovering a hobby you used to enjoy. Being interested and engaged in something is just so beneficial. You may have heard already, but try to stick to reliable sources of information about COVID-19. So, for example, the HSE website would give really accurate information. And seek updates only once or twice daily. Stay connected with others and maintain those positive relationships. And I suppose now we have to find creative ways to do this. So, for example, it might be setting aside a time to watch a film together with your friends, with your loved ones, on Netflix, for example, but remotely. So, arranging to do this over Zoom and organising to chat about it during the film and afterwards. Several work teams I know now organise to have regular coffee breaks via Zoom, to give that informal contact we had before COVID-19 and we miss now. Some people can find it very difficult to look after their own self-care. Maybe they feel guilty about taking the time for themselves, and some people can find that they're too busy. And what I'd say is remember the safety announcement when travelling on a plane. So to put on your own oxygen mask first before you go and tend to somebody else. The same is true for self-care. We need to look after ourselves first, and then we can look after other people. Planning ahead and putting self-care activities in your daily routine can make it more likely that it will happen also. And it might not be easy, but once you notice the benefits, you'll see that it's worth it. So managing emotional distress and your psychological well-being during this time is as important as managing your physical health. I'm going to give you some suggestions on several things you can do if you feel anxious, if you feel panicked, if you feel scared, or if you find it hard to cope. And you might decide to take note of these and other techniques you find helpful in a well-being plan. People tell us that they find it helpful to have techniques recorded and in a safe place to access easily when they feel distressed. So you'll see in this wellbeing plan, it is broken into different sections of strategies that might help you. I am going to talk to you about things you can do that take about 30 seconds, things you can do in about 3 minutes, and things that might take 30 minutes or longer. So the 30-second fixes are quick fix emergency actions. So this could be taking a few slow, deep breaths, maybe breathing in for a count of 3, breathing out for a count of 3, and doing this several times. Sitting on a chair and focusing on the sensation of the chair pressing into your back and your bottom. Noticing your feet in touch with the floor. Maybe looking out of a window or doorway. What can you see? What can you hear? Anything new or unusual? Really bringing your focus to your senses. It can help to take a few sips of cold water, focusing on the cooling feeling as you swallow it. Even better if very cold. And think of 2 things that are just about okay right now. Examples of 3-minute fixes are maybe doing a quick brain workout. So maybe doing a word search or a crossword. Maybe phoning someone for a quick chat. Making yourself a hot drink and sipping it slowly, feeling the warmth of the cup in both hands. Maybe listening to a favourite piece of music, something that will soothe you and be uplifting depending on how you feel. And 30-minute fixes. Going out for some fresh air if you can. Doing something mindful. So focusing on one thing you were doing, such as eating, walking. Maybe having a bath with music and candles. Using a wellbeing app, maybe Headspace or Calm. So maybe doing a proper sort out in your house. So maybe clearing out a cluttered kitchen, organising a drawer or a wardrobe, and feeling the satisfaction of having done something. Maybe preparing a tasty meal and really savouring every mouthful. Also for you to know that there is a free online program called Stress Control Training running until December and hopefully again in the future. And this consists of six video sessions streamed live by Dr. Jim White, who's a clinical psychologist. And the program teaches you practical skills to manage emotional distress. I would recommend keeping an eye on the Stress Control website for dates, and I'll include this at the end in the resources section. We know that learning to get a handle on worries, anxieties, emotional distress gives us relief. However, it doesn't necessarily guarantee that we will live well and feel positive emotions such as joy, excitement, happiness. Well, what we know is that well-being comes from living a life with a balance of activities that give you feelings of pleasure, achievement, and closeness. We know that when this is out of balance, it can affect your mood. So, for example, if we spend a lot of time working and little time for pleasure or socializing, we can feel low or isolated. COVID-19 has changed our normal routines and daily activities, and we can find that the things we did to look after our well-being have become difficult. However, it is important to be creative and plan activities into your daily routine. For example, plan to do things each day that are pleasurable to you. This could be reading a book, it could be having a coffee, watching a favourite TV programme, going for a walk. Also, having achieved or accomplished something can leave us feeling really good about ourselves. For some people, it might be completing an exercise regime, it could be doing housework, it could be mowing the lawn, whatever it is that gives you that sense of achievement. We also need connections to thrive and flourish in our lives. So include at least some activities every day that are social and involve other people, remotely of course. Check in with yourself and ask yourself every day, what did I do today that gave me a sense of achievement, pleasure, closeness with others? Did I get a good balance, or what can I do differently tomorrow? You might also be interested to know that the HSE has launched an online program, Minding Your Wellbeing, and this provides tools and guidance to develop and maintain a positive outlook during COVID-19. So in summary, COVID-19 has challenged our lives in lots of ways, and it is completely normal to be feeling a wide range of emotions as a result. Managing anxiety and your emotional well-being during this time is as important as managing your physical health. We recommend focusing on your self-care, having a daily routine, attending to your basic needs, staying socially connected with others, watching your exposure to social media and your intake of alcohol and caffeine, and also making sure you keep up your hobbies and interests. Remember, nothing lasts forever, and this will pass. It is just one chapter in our lives. It will not define us. Here are some links you might find useful. There's a link for relaxation, mindfulness, deep breathing exercises. And I've also included the 2 links for programs I've mentioned. One is the Stress Control program, and the other is the Minding Your Wellbeing program. Thank you very much for listening today. I hope that some of what I've spoken to you about may be helpful, and I wish you well.
Thank you, Tara, for a very informative and helpful talk. I'm sure that a lot of us will gain a lot from what you've just told us.